This podcast represents the opinions of Katie Allen, PA, and guests of her show. The content is for informational purposes only and in no way sets up a patient relationship. Consult your healthcare professional for any medical questions. Now, here's Katie Allen.
Jay, for introducing us this evening. I have Rhonda Massey, who is a certified nurse midwife who's currently working with NGPG's OBGYN in Gainesville, Georgia, which we will give you all of that contact information at the end of this. But I have been looking forward to this interview a lot because we're going to talk about some lady parts. Or I was trying to think of all the words to call this lovely lady area, like the vagina. That's just what I should call it because all the other things downstairs. What are some other things people say?
They're Brittany.
I have never, ever.
They're Kitty.
Oh, yeah.
Brittany from Britney Spears from showing her Brittany
stuff. Yes.
Uh-huh.
And then they're Kitty.
And they're Kitty.
Uh-huh.
And all the vulgar words.
Yeah, the ones I can't say on here.
Uh-huh.
Yeah.
Yeah, it just keeps going on. I hear a new one every day.
Yes. And we appreciate these lady parts. So we get to ask Rhonda, or I get to ask Rhonda some questions. And we're going to talk about some things related to the lady parts. And she's going to help me answer them because I don't know the answers. But this might be just the first episode because lots of us have lots of questions. And the goal here is to ask you questions that sometimes, people want to know, but maybe there isn't enough time in their visit with their OBGYN, or maybe they're embarrassed and at least start the conversation and they can say, I was listening on Make Me Pretty podcast to that Rhonda Massey who was talking about this certain subject. So we're going to go through and talk about some things with the idea of just trying to educate you guys on some things that are hard topics, I would say, or just private topics, literally private.
Literally private.
So we're going to start out with talking about the anatomy of the vagina.
So let's talk about the top, which is what most people think of their vagina. The vagina is actually the vault. It's not the vulva or the mons pubis. So let's go through those. So mons pubis is the top or the part that grows hair that most people want to hide.
Mm-hmm.
The vulva you have two of them. You have the labia majora, which is the outer ones that mostly grow hair. Then you have your labia minora, which are the ones that typically do not. And then you have your clitoris at the top.
Best part.
And then you have your vagina. So here we are. We are not talking about all vagina. We're not talking about the vault. We're talking about all the lady parts and all of the female anatomy.
I'm really glad she just cleared that up. I would have that wrong. Thank you. So how do we take care of these lovely lady parts?
Okay, so you have heard, just let it take care of itself. It's a self-cleaning oven, but that is the vagina, the vault. Do not use any sponges, gloves, oils, anything with any fragrance.
Food products.
Yes, don't use any food products. I have a good story about that one. Anything down there whatsoever. So you really should just use water. So just the removable heads from the showers are great, especially postpartum moms. Oh, we can talk about that later. Mm-hmm. So just use water, splash it around down there on the labia minora, the vulva, and that's really it. And then the vagina itself, the vault, the hole is where you should just let it be.
So no soap.
No soap. And if you feel like you have to use soap or you're shaving down there, if you're going to use anything, just use Dove soap.
Got it.
The Dove White Bar for sensitive skin is the best thing you can use on there if you feel like you're dirty.
Yeah.
But really just water's all you
need.
need.
Because you've been running.
So if you're at the gym and you're going to work, there is some wipes. I think the best ones out there is the Lola brand, which they make the
L-O-L-A.
L-O-L-A. They make tampons and pads. I think they're now making some lubricants. Maybe they're doing all kinds of good stuff. But they do have wipes that are purposely used for after gym, after working out. If you're going to work and then to a date and you want to be tidy down there. Those, and I think Summer's Eve makes some, but nothing with scent. No Tahitian vanilla or ocean breeze. You don't want your vagina to smell anything.
Because it might get irritated.
It will get very
which makes it
irritated.
useless.
Yes, then you'll be coming to see me.
And not for the fun stuff. Okay.
No. Even tampons, you want to make sure that they're unscented, no fragrances, no dyes.
That's good to know. What about on that, taking care of the lady parts, the idea of cotton underwear? Because we always hear about the cotton underwear. So does that mean like, you know how it's got the little cotton part in the lacy part?
You want that to be white. Especially, everybody is definitely prone to either bacterial vaginosis, which we can talk about. We can talk about yeast, but the cotton middle piece has no dyes if it's white, which is good.
Yeah.
No fragrances, of course, so nothing in your laundry.
Underwear.
You want pretty delicate underwear, right? But those delicate underwear should be washed in hot water with free and clear detergent. You can dry them as fine.
Okay.
But definitely no fragrances in them.
That makes sense to me.
And make sure that piece is white because cotton breathes. It allows air to move in the lady parts.
Yes.
Which is important to prevent yeast.
That's what we've heard, but
Yeah.
So on that, sleeping.
No panties.
Okay. So just
Like Commando. Let it air out.
I like this. All right, this is good. I'm gonna new things.
Yes, yeah.
Okay.
New routine.
Okay, new routine. So it's either cotton or it's nothing.
Mm-hmm.
And
nothing tight. Nothing tight.
Nothing tight.
Mm-hmm.
And so if you do wear something like a cotton short, maybe.
I think it's fine. I think anything cotton is fine.
Okay.
Yeah.
Okay. We're gonna start with that.
Cotton shorts, cotton underwear, nothing. That's gonna be the best thing.
What about the ladies who, not myself, I just can't. They love soaking in that bathtub.
Totally fine.
Okay.
I think Dr. Till's Epsom salt is actually fine to use. I would not use any bath bombs. I wouldn't use any of those, especially the cheap bath bombs. I wouldn't use any of the watercolor changing things, any oils in the bathtub. And I feel like a lot of people come, they want to be all natural or they're having an issue and they start using the natural. I don't even know the brand name.
Keep it simple.
Don't. Just use water. If you feel like you're dirty and need to shave down there or extra want to use soap, just use Dove soap. Okay. No squeezable. No Bath and Body Works. Nothing squeezable.
What about the Dove? Because I'm sorry, I'm going to get these. I know these questions are coming. Just the Dove body wash and pump. Or
no.
Is that? No? Okay.
Just
the Dove bar soap.
Bar.
Okay.
Mm-hmm. Oh.
Don't go to her office. And if you're irritated, you do need to go in. But don't go to her office saying that you did something else.
Let's talk about loofahs. Loofahs are disgusting. They are sitting in your shower most of the time with the shower curtain closed. Crowing. And you wash your vagina and then you hang it up and then you wash your vagina. They're all white. Don't ever use them.
Yeah. That makes
they're for fun for kids' arms. That's all they're fun for.
Now, so we're talking about that's hilarious. Yeah. The rest of your body. So since we're on the shaving subject, I'm going to cut you off guard a little bit. But what about shaving the lady parts versus leaving it alone versus waxing? When you've been doing this now for how many years?
We are going on to 13.
So going on 13 years of seeing a lot of lady parts and hearing a lot of stories, I'm sure. So what are your thoughts on all of that stuff?
Pubic hair comes in evolution.
It does. I don't understand though when they say take it away and then they say now it's trendy. It's a problem, okay? Because my God.
So I do feel like 13 years ago, everybody was shaved, everybody was bald.
Yeah.
And then everybody went into manicuring, having a landing strip or some type of triangle. Yeah. I think I've seen a star before. That was pretty impressive. And then it went back to shaving bald. And now I feel like we're back to the illusion of leaving something. But I do have to say, shaving is totally fine. It's totally your preference, your partner's preference. Typically with more hair, you do tend to have an odor.
That's fine. Our hair usually.
Yep. And again, a vaginal odor is fine as long as it doesn't have a terrible fishy odor or a terrible, terrible, terrible itch. It's fine. But it should never smell super foul. And you shouldn't be able to smell it throughout the day just walking around.
That's a good point. Yeah. I mean, something's going on and you really do need to see that.
Waxing is great. People love it. I do have to say, make sure the place is a clean, reparable place. Read the reviews.
And some people get a folliculitis syndrome.
Exactly. So if you do, just use over-the-counter antibiotic ointment. Aquaphor works wonders for down there. It is totally fine to use Aquaphor down there.
Okay, so we've been talking about the ways to take care of the vagina.
And not cause any problems.
But sometimes problems occur, whether or not that's people not taking care of things appropriately.
Or vacations.
Yeah, vacations. Just things are off. We talked about genetics sometimes play a part for sure. But the things that we're going to talk about here aren't necessarily that people are dirty or anything's gone wrong, right?
Yeah, going on vacation and you forgot your soap, and the only soap you have is the soap on the counter that's wrapped in that pretty little paper that you unwrap and you use all over your body, and you use on your vagina, and then you come back to me, and then a few weeks later you have a very fishy smelling vagina. Yeah, which is not pleasant. Also, hot tubs can cause it too, which I don't want you to ever go on vacation and not enjoy your vacation and not get in the hot tub, but hot tubs seem to be notorious.
So why is it some of us just get lucky and then some folks don't?
And I feel like we all tend to go through changes in our life and hormone imbalance and maybe getting into a little nursing acid-base balance in your body. We're all a little bit more acidic sometimes, and we're a little bit more basic sometimes. But BV, bacterial vaginosis, is not sexually transmitted.
And that is the one that has the fishy odor, right?
It has a fishy odor.
That's a test question always on our boards.
Absolutely. There is an STD that has a fishy odor as well, but typically that has a little bit more symptoms with it. So BV is probably what I see the most in my office. And it is normally, I change my soaps. I change laundry soaps. I went on vacation. My husband and I got a new lubricant. We were having fun. And then now you have this very foul discharge, fishy odor, normally accompanied with a grayish discharge. And it's a little itchy, but not severe itchy. It's almost a squirmy itch, like you just want to squirm all day. Raw feeling. That is your classic BV.
That sounds like that.
And it is. And it's very easily treated. It is with just an antibiotic, either oral antibiotic or a cream.
Okay.
And that's it.
They just need to go in.
They just need to come in and see me.
Yeah.
Now, what BV means is when the pH of your vagina is off, whether from all those new things, a change in soaps, and you've killed all the good bacteria and then the bad bacteria is overgrown.
So then they're going to get this medication.
Yeah.
Does that medication have any side effects usually?
The oral one, which is Flagyl, you don't want to drink any alcohol with.
That's what I was getting into.
I
don't really remember. I just remember that, again, it's a more question.
Always ask those people, do you have an event coming up? Because if so, let's use the cream. And I do think that both of the cream or the pill works just as equally as well. Just depends on if you have an event where you feel like you're going to be obligated to drink.
And do you think that some of those patients are just more susceptible?
I do. I do think that people's pH of their vagina is just, we have a wide range of pH in our vagina. And if some people's are on the higher side, anything that's going to tip them over that edge of BV. And people will call like, girl, I totally went on vacation, totally used the wrong soap. I know I have BV. I'm super sensitive. Then we're more than happy just to send them antibiotics for. Now, if they take the antibiotics and it's not getting better, then you would need to come in and we could do a swab.
So you mentioned that they can walk around kind of being itchy. So itchy, I think about, just because I'm in surgery, so we have some folks that are on antibiotics and then they have other things that cause itchiness. So how do you know the difference between that and like yeast and other things that cause itchiness?
So yeast is completely different. Yeast is a fungus, and it is thick, white cottage cheese discharge. And it is so itchy where you want to take a toothbrush to your vagina. It is, you cannot keep your hands off. It is, you just constantly want to go wash your vagina, touch it. You cannot leave it alone. That is yeast.
That's the difference.
That's the difference. And people will call in saying, oh, I think I have yeast. Can I have a prescription? And sometimes people will just send in the yeast medication, or Monostat 7 over the counter works great for yeast. Now, if you were diabetic, the monostat-7 will not work for your yeast.
Meaning that they need the oral as well.
They need the oral or a different type of cream.
How many days of oral do you usually give?
I normally give 1, and then 3 days later I repeat it no matter what.
Okay. Mm-hmm. So we're in plastic surgery. And we give 3 days, but then we tell them to do the topical as well. But it's really just because that frustration in between while it's starting to work,
misery.
Right?
Yeah. Yeast infections are just misery. Another good thing you can do for yeast and BV is take a probiotic daily.
Okay.
Now,
do you have a suggested one?
I do. Not necessarily a brand, but I do recommend a refrigerated probiotic.
Okay. Can you give us a couple that you would tell folks or not really? So like a refrigerated probiotic, meaning like in their yogurt or like a pill?
Either one. Don't care. So Good Nutrition here in town has them. I've heard some Publixes have a refrigerated section in the pharmacy section that has a probiotic. I don't care what kind they are, but if they're refrigerated. It's going to be more expensive. Right? They are live. Okay, that's good to know because then it's worth you spending more. Correct. If you buy the ones that are dry over the counter, the bacteria is dead. It may work a little bit, probably not work near as good because just really kind of throwing money down the drain. Now, if you want to do a cheap version of good bacteria to take, would just be Activia yogurt. Okay. Mm-hmm. Did you hear? So Activia, and that's on the commercial. Yeah, that's in the commercial. Yeah. So this like BV, do you think that some people are just more susceptible? I feel like I've got friends that'll tell me things, and I just whether it was that they were pregnant or that they went to the beach or whatever, and it just seems like they're more susceptible. And I do feel like, yes, I agree. But once you have somebody that gets BV, it seems to be it starts that cycle where they're coming every few weeks. Like, oh my gosh, I took the medication. I was good for a few weeks. And then here I am back. And it all has to do with that good flora in your vagina. So that's to replenish. Do you see that same thing with the yeast then too? Not necessarily with the yeast. Okay. If I'm seeing somebody with recurrent yeast, I'm worried about diabetes. Okay. Mm-hmm. Or they're question too. Yes, that is a great one. Or they are somebody that works out a lot. Okay. That's sweaty down there. Maybe dark, they need to be changing their pants. Mm-hmm. Yeah. Using those wipes, the Lola wipes. Yeah. Even just take water in the shower at the gym, rinse off really well, let it air dry. Is very important. Yeast grows in dark, moist environments. And you can't walk around with your vagina hanging out or your lady parts hanging out, right? Yeah. Not your vagina hanging out. Your vagina should not be hanging out. The image I had in my head at the gym, I thought, if that's hanging out. Maybe we need a little mental health. But it tells me it's back to, again, especially if somebody is their first time or their first times having some of these symptoms that they really need to see a medical provider to make sure what it is and not necessarily trying to treat it on their own. And then it sounds like over time, if it seems to be that somebody's having the same type things. Of course, from what I'm hearing from you from BV, because again, all I know about BV is how to answer a test question, which isn't helpful really for this, but it's sounding more like if they're having that recurrence, maybe they need to look at some other things that are going on. Like again, whether it's that they're using something like a live culture, I guess, or the live probiotic, or I keep saying that, but refrigerated probiotic, or if they've got things that might be. Yeah, so if you come in my office and you're like, oh my gosh, I've never had this before, what is going on? I think I had a yeast infection or a UTI, something is not right down there. Okay, so itchy. Now, Bernie. So you are going to, is that area just burning on its own, or is it when they're going to pee, or what is this? So when you go pee, it is burning so badly where it brings tears to your eyes and you don't want to pee anymore. And then what do we think that is? That is a UTI. Yikes. Urinary tract infection. Which can make you sick. That eventually. Can definitely make you sick if it is left untreated. Okay. So UTI, classic symptoms. You're peeing every 5 minutes, a drop comes out, you're tearful because it hurts so bad. You leave the bathroom. You're sometimes spotting, bleeding. That's when pretty bad. You can have a fever with it. Low back pain on either side of your back, like your kidneys are hurting. That's typically more severe. But let's get this right. You have a urinary area and a vaginal area. Correct. 2 different organs. Yes. UTIs are in your bladder and in your urethra. Got it. Not your vagina or your vulva. That's right. 2 different things, 2 different organ sets. Yes.
Yeah.
And you need a culture. Cranberry juice, you hear about all the cranberry juice and the AZOs. Yes, the AZOs work wonderful over the counter because they change the pH of your vagina so it doesn't burn as badly when it's going through the infected area.
But does that change the infection?
No, it does not. It does not treat you. You still need to come see us. You still need to go see urgent care, primary care. Don't care who you see. You need to see somebody. You can't just call us and ask for a prescription.
Got it.
UTIs are caused by all kinds of different bacteria. And what we mean by culture is they take your urine, they spread it out onto a little petri dish, they put different antibiotics on it, and they tell us which antibiotic treats it the best. So if you come to my office, we can do a little quick test in the office to see if it's got some nitrites, which is bacteria, which is indicative of a UTI, or some blood if you're not on your period. We are going to go ahead and treat you. But then we'll send off your culture. If we need to change the antibiotic treatment, we will give you a call and change the antibiotic.
So why do they get this? Why are some people more prone to this or not?
Oh, this is a whole lengthy
that's
conversation.
I know, actually. What's so funny is I started to ask you that and I looked at you and went, boy, there's a flood. So let's simplify it.
Let's make it fast.
Let's simplify it for the sake of besides anatomical. I'm making the little that I know of it, but just besides anatomical issues or functional issues, things that are more in a urological.
So I feel like in your late 20s, 30s, early 40s is more often geared to just living life, as in you're running the kids around, you're being the taxi driver. You're not urinating every 3 to 4 hours, which is what you should be doing, emptying that bladder, keeping that urine
I got that covered. I'm like an hour. They're letting me out of surgery to go pee.
That is one of the bigger things is keeping that bladder empty versus the urine just sitting in your bladder becoming infected. And the biggest thing that I see in the office is sex. We have sex. We lay there. We don't get up and go to the bathroom.
But you're supposed to go pee right away.
You are supposed to get up and go pee immediately. And what that does is all the bacteria, whether it's from foreplay or actual coitus, bacteria is just being pushed up into the urethra, which is where pee comes out.
Girls, get up and pee.
Get up. I know. You don't want to, but get up and go pee. But the urethra is very small. And why doesn't this happen with men is because their urethra is much longer.
Correct.
So it has a lot harder traveling up. And then normally as it's traveling up and taking all those hours, they get up and go pee the next morning. And then there's no bacteria there. They have no UTIs. But with women, our urethra is just inches. It's very tiny, very short. So it doesn't take long for us to get infected.
So get up and pee, ladies.
Get up and go pee.
Yes.
Next thing is wiping front to back. You don't want any anal incontinence.
Yeah.
Any anal incontinence, any remnants whatsoever into the vulva, vagina, or urethra. That is one of the biggest
Front
ones.
to back.
Front to back.
But we gotta. Don't you learn this in school? Like, don't we?
I don't think
did we learn that?
us.
Maybe I learned that in medical stuff.
I think we learned in medical stuff.
Okay.
With being said, not making this maybe be the next podcast, but if you're having sex and you like anal sex, you cannot go from anal to vagina.
Duh.
It is, you cannot do that. You can't go back and forth. You got to go from vaginal to anal.
All right, next episode is going to cover some of that.
Yeah.
But
now, maybe if you want to use condoms, a lot of people will use condoms. You got to change out your condoms between your vagina and your anus. No anal
don't take
incontinence.
the dirty and put it to the clean.
That's right. Your vagina is a clean, right? It takes care of itself.
Yeah.
It's a clean oven.
Yeah. Don't contaminate.
Don't contaminate.
Okay.
Yes.
So that was good. Don't contaminate. Pee after sex and pee often.
And the biggest thing do you feel like all these new companies out there that are promoting cranberry juice and cranberry supplements? Oh, the evidence is a little bit out there.
And whether or not it actually has even what we need to be helped. I always go back to me, most of the talks that I've heard go back to, yes, it's good to increase that fluid
Increase
intake,
your water.
but you still got to get the antibiotic for the most part.
Correct. Yeah.
Because of the risk of getting further up the
Now,
track.
the cranberry extract and the pills, they think that has to make your urethra where it's slicker.
Okay.
So
it's possible
that things can pass through easier and not get so sticky. That's where they think the cranberry juice comes in. But again, the evidence for it is
out there,
Delicious.
and who's going to risk theirs? Because again, if it doesn't get treated, then we've got a problem where it can get up to the kidney and really make you sick.
And then you go to the hospital for
Yeah.
days. Yeah.
And that bill.
Let's not do that.
Let's not do that.
Wipe front to back and get up and pee afterwards.
Just come on.
Go pee. Get up and go
Yes.
pee.
So let's go back to talking about
The vagina.
the vagina because that's our topic for the day. So
Actual vagina this time.
the actual vagina, and that I think of the vagina. We're going to go into kind of dry versus moist vagina. So I think of the vagina as being a very moist environment in general. But what about those that are saying they've got this that it's dry?
So, yes, dry vagina can happen at any point in our life. And I do feel like a lot of people do not realize this. When you are breastfeeding, lactating, whatsoever, you're in a menopausal state, which means lack of hormones, lack of the estrogen and the progesterone. And that means a dry vagina. So if you were breastfeeding, just recently stopped breastfeeding, it's going to take a little bit of time for those hormones to increase.
A little bit of time, like
Several weeks.
you know what? They don't always tell the patients this.
They
by the
don't.
way.
And it's
Yeah.
amazing to me. I always kind of tell people when they're in their office in the 6 weeks and they're starting to think about sex. Some people have already had sex. Some people are waiting until they get cleared with me. And some people are like, can you totally write me a prescription that I don't have to sex for 6 months? I'm like, absolutely. Whatever you want me to do.
It's
But-
because they're breastfeeding.
Yes.
Yeah.
It's because you have a lack of desire. You feel like sometimes that lots and lots and lots of lubrication. So we can talk about different brands, but there are several things that we can do on a daily basis and an act of lubrication. So if you feel like your vagina is itchy or scratchy or just uncomfortable, then that on a daily thing, then I would definitely recommend a daily moisturizer, just like we
And-
do our face.
And I think we discussed.
Right, you take care of your
so
face,
it's a
you should take care
moisturizer
of your
for the.
vagina.
So yeah, so they're going to use that. They're going to use that, and that is not on the inside of the vulva.
You can do either one depending on how bad. So there is this company called the V-Hive. They have a chapstick
Like
for
a,
your lips.
like a stick.
It is a straight up, looks like a chapstick.
Okay.
And you can use it fresh out of the shower, on a date before you go on, like on a, but it's literally in a tube of chapstick and you just rub it on your vagina lips, inside, outside. And that is totally sufficient.
And I am not laughing at those that need that, okay? Like I was just picturing, sorry.
Don't confuse it with your real
I'm
chapstick.
so sorry. I went into an image here. So so you've got this stuff and they're going to use it on their area because
Yeah.
it's dry.
Correct.
And they're going to use it on the inside of the lip.
Yep, you can use it on the inside, outside.
Okay.
Absolutely. Now, this is for daily moisturizer. This is for like, okay, my vagina's itchy. It's a little scratchy. I feel like it's dry.
And we kind of
This
talked
is
about, just
not
so you guys
sex
know,
related.
yes.
This is
so
daily.
just daily in certain individuals, we're going to avoid kind of talking about, we do talk about or see a lot of the vaginal dryness postmenopausal, but we are going to kind of avoid that subject. So for those of you that are postmenopausal and kind of listening in, that's a
you can do this too, but we have another better option for you. Yeah.
Okay. So, but in general, this is the person that's maybe breastfeeding.
Breastfeeding mid-30s, we get in our early, this is really scary, early perimenopausal in about mid-late 30s.
I don't
Our
get that.
hormones, yeah.
No.
Our hormones start to decrease in our mid-late 30s. So a lot of women, we have our babies in our early 30s. We're breastfeeding for a year. And we come out and we're like, good gracious, I have no sex drive. My vagina's dry. I don't want to do this. And then we get done breastfeeding and we're expecting our sex drive to go up and our vagina to become more moist. And then our hormones are already plummeting. And we never get back to that 20-year-old moist vagina.
I don't know what I'm sorry. So y'all need to go see your people.
You need to come see us. So
that occurs
now
when-
V-Hive, that chapstick is more expensive, more cool route to take.
Okay.
Honestly, the best thing is coconut oil.
Okay.
Olive oil works great for your vagina. Keep some in the shower. You know, the coconut oil is hard, and then as it gets warm, it becomes more liquid. You can rub it in the vagina. You can rub it on your labia, your vulva, and you can actually use it during sex.
Okay.
Coconut oil and olive oil are great lubricants.
Okay.
Now, if you're using condoms, no oil. whatsoever. It'll break the
And
condom.
if you go to your shower and it looks like it's all been used up, someone else maybe was used it.
Don't mix up your kitchen and your shower, please.
I was just thinking about
Same
the
thing with
nails.
your chapstick and
Yeah.
your lady
Yeah,
chapstick.
don't. So, okay, so that's good to know, though. So the olive
Yes.
oil and then coconut oil.
Yep. And as we approach 40, there's all kinds of good lubricants we can use. There's hyaluronic acid, which is huge in the cosmetic world.
I mean, I use that to inject into your face.
I'm telling you, it's great. It increases.
Not the same one.
It increases the receptors, the estrogen, progesterone receptors. It makes our vagina more plump, which means more moist, more rugae. Yeah, hyaluronic acid is great. A newer one is DHEA suppositories
Okay.
that you can use daily
Okay.
for like a week, and then you use them as supplemental. So you
That's
do
what's in. Is that fish oil and stuff
Yeah.
or something? Yeah.
So you do for a week, and then you do every other day. I normally just say Monday, Wednesday, Friday, and then the next week do Tuesday, Thursday, and then you can just do weekly after that for the DHEA. Biggest tried and true gold standard is just vaginal estrogen
Okay. And they get that by prescription.
by one of us. Mm-hmm. Yeah,
And that's
provider.
typically people are starting that.
I would say 40 to above.
And again, what is the symptom that's making them start that?
Dry vagina, lack of sex drive.
Okay.
That'll definitely help. Painful intercourse is another one.
Man.
Yeah. It's not right being a woman. Old age is
I
not for
don't know.
sissies.
Yeah. Well, some of us are enjoying aging. I don't know. It's different for everyone.
It is different for
I was like,
everybody.
well, I just
You're
started
right.
living. What
You're
you
right.
talking about?
I guess we can talk about lubricants.
All right. Tell us.
All right. As we said.
So you said
no
first off, oil
and condoms do not mix. They'll
Okay.
break down the condom.
So use not olive oil,
Water-based.
not
You want
coconut oil.
water-based.
Okay.
Yep. Water-based best lubricant out there is, there's a couple. The one that I recommend the most is Just Like Me by Pure Romance.
Okay. Just like me.
Just
Pure
like
romance.
me. It's water-based. It works great. It doesn't last as long as it's silicone-based, but you can't use silicone lubricant with any of your toys. It'll break them down.
Okay.
So you kind of got to be careful.
So this one, the one that you just mentioned, you can use with toys.
Yep. And Just Like Me is a great one because it re-wets itself, which means you can put it on before your date and it'll re-wet itself as vaginal moisture picks up. Mm-hmm.
Okay.
Some people use it as a vaginal moisturizer every day too, but that would get kind of expensive. I don't know what
Maybe
the
your
cost
vagina is worth it.
Maybe totally worth it. Maybe you can get lucky every day.
On your own. Sorry.
That's a good one. Lubricants. You don't want anything with glitter.
Okay.
No scents, no smells, no tingling, none of that stuff. Let's just let it
That
be.
makes sense. Put the
Yeah,
glitter
you
on the rest of your
don't-
body.
Oh my gosh, I heard that there is this new, I don't even know, I think it's this, one of the girls in my office was talking about it, a suppository that is a glitter-filled pill with lubricant.
Like a surprise.
It is like literally surprise. I mean,
Surprise.
I don't think you want glitter
It's
in
a
your
party in
vagina.
your pants.
I mean, that's talking about STDs. I feel like STDs are glitter.
This sounds like a BV nightmare.
Yes. Please don't do that.
This sounds like a surprise you need to take to your GYN. Why don't you take it over to your midwife? So, plain is better. I mean, keep
Plain
it
is
simpler.
better. Water is great for intimate, spontaneous toys. There's no dyes. There's no pH. Water is just kind of your quick and easy go-to.
For the dry.
Mhm. Now there is the newer one out there, which I don't know a whole lot of research about, is the CBD lubricant.
Okay.
I don't know about drug screens, how CBD
Yeah.
works with drug screens, but it is great for women that are worried about if they have some pelvic tightness or painful sex related to their musculature.
I wonder
too
how
tight.
much absorption folks get with that, too.
I'm not sure of that.
Yeah.
But it does. I've heard that you put it in for a little while, use it, give it, 10, 15 minutes. It will relax the pelvic muscles and vagina. And it
So
is
does wine.
great for
I'm just
sex.
kidding.
So does wine.
Sorry.
I don't know how good
I'm
my
so sorry,
patients
that
feel.
was good.
I mean, it's kind of bad if I tell them, just have a glass of wine and then have sex.
Yes,
It's pretty bad.
the
right?
CB. I think that's Reinhardt did it. Sorry.
Yeah.
So, and I know they actually have that oil at the dispensaries, and even with the THC.
Mm-hmm.
But again, in this area, just for legal purposes, the CBD. It sounds like when I was on a rotation. So that's, oh my gosh, that's 17 and a half years ago. he had mentioned kind of, applying any kind of a lubricant, especially if they'll do it to the clitoral area, and you'll just instruct your patient to do that at a slow, reasonable rate. Well, it might make things feel better, but is that because of the stimulation, or is that because it's actually doing something?
Lubricant is never a bad thing.
Sounds good.
I have tons of people, even at 24, 25 years old, that come in complaining of painful sex. I'm like, well, have you used lubrication? They're like, well, no, I don't need it. I'm like, okay, well, lubrication is going to make everything feel better. Even if sex feels fine in the beginning and then it becomes dry throughout, whether that's 3 minutes later, 5 minutes later, 10 minutes later, lubrication does nothing but help things. It helps things with sex itself and just pleasure itself.
Period.
Lubrication is a great thing.
That was a lot of dry vaginas talk.
That is
and again, there's other reasons why somebody might have it, that hormones and things that they need to speak and talk more extensively with their provider. But this was
This is kind of like a quick,
yes,
in a little eggshell, kind of quick surface.
yes.
Yeah. To dry vaginas, 40 years and old, definitely estrogen would make a huge difference. And then you can use your lubricants on top of it.
Estrogen cream.
Estrogen cream.
And
vaginal estrogen.
That also does some other things too.
Mm-hmm. It definitely plumps the vagina, makes it more moist, which will definitely decrease BV, the bacterial vaginosis, because you're keeping it more moist, the pH more normal.
What do you think about that Thermivah?
I mean, if you can do it, girl, and you can pay for it, and you have somebody who
That's
gets
the
it,
problem.
go for it.
But I'm bougie, so my vagina's bougie.
I think it's a great choice.
It's a possibility, but it is expensive. So anyway, let's talk about vagina. What do folks need to be doing to take care of this precious thing every day?
Wash it with water. Wipe front to back.
Okay.
And use lubricant during any experience. It's just going to make it better.
Okay. All right. That's like in a nutshell.
Yeah.
Take care of it, people. Okay, so just to kind of round things out, since we're talking about that vaginal space and area that happens to have a lot of functions to it, but one is sex. So tell us about safe sex. What is safe sex?
Using condoms. I mean, I think being smart, I think asking your partner, whether that is a new partner, whether that is a partner you've had for a while, what is their STD history? When is the last time they were tested? Take a good examination. A lesion may be folliculitis, which is an ingrown hair or a little, infected follicle.
But you don't know.
But you don't know. Herpes is an STD.
Don't want that.
No, you don't.
And I'm sorry for those of you that have it out there.
It is 1 in 3 people have it. Once you have it, you
that
cannot
is a high
get
on that.
rid of it.
I can't let you go past 1 in 3. That's a lot.
It's a lot. And a lot of people, they'll come in the office and get tested for every STD. If they're just for screen, they don't have any symptoms or a lesion. And I can tell you probably 80% of people are positive, which means they've been exposed to herpes virus, whether that is through a cold sore, through a lovely aunt that pinched your cheeks and kissed you on the mouth, and you got it that way, or through a sexual encounter. A lot of people have HSV virus in their body. We can treat it. We treat it pretty aggressively. If you can start treatment within the first 72 hours will be the best treatment. And then we can kind of decide, do we want to start immediate treatment every single day? Or do we want to see how often that you'll have an outbreak? Everybody's a little bit different on their personal opinion as a provider and as a patient if you want to take a pill every day to prevent. But condoms only cover the shaft.
That's right.
Do not cover anything else. So if there is a lesion anywhere else on the shaft, the condom is not protecting you against herpes. So take a good examination.
You guys need to examine things.
Yes. And question.
Like a medical person. Okay, so in general, safe sex, condoms.
Gonorrhea and chlamydia are the next, probably 2 most common that we see. We test for these routinely. You can actually test for these off of urine or a vaginal swab. So if you're a teenager and you come in my office and you're sexually active, I definitely do recommend a gonorrhea and chlamydia test. Again, that can be off of a urine. It doesn't mean that I have to look at your lady parts. Trick is, in my opinion, the grossest one. These 3, gonorrhea, chlamydia, and trick, are all treated, so you don't have them forever like the herpes. But the trick is a bug living in your vagina.
That's gross.
It is just gross. It's making colonies down there. And it's funny, we were actually talking about this in my office the other day. Gonorrhea, chlamydia is probably the most common that I see local STD as in like local to the vagina. Gonorrhea and trick are probably your more not so common ones, but trick does, and gonorrhea does tend to come in waves. Like you'll have several trick outbreaks and you're wondering like, do I need to keep a list of myself? Gonorrhea is the same way. But
Because it can disseminate and then go into other organ groups and things
correct.
too.
It can cause pelvic inflammatory disease, which therefore
things.
can lead to infertility. Yeah. And all these three can be prevented through use of a condom. Remember, after treatment, we recommend no unprotected sex for 4 weeks. Trust communication and wear a condom.
Wear a condom. And pee after sex.
And pee after sex and take a look.
And take a look. And drink a lot of water.
A lot of water.
A lot of water.
And keep a wet vagina.
That's right. So I will say we hit on some great topics to me. Again, I was really excited about this episode because I feel like there was a lot of discussions. You know, I work in a plastic surgery office and it Make Me Pretty podcast over here. You know, I'm in discussions with different people and I feel like there's a lot of discussion that happens, but a lot of folks kind of know but don't really know. Just to have you here today, just so thank you for coming. Thank you so much for discussing this because we've got so many things that we're covering and we hope again to do another episode coming up. We're going to tell you that in a minute, but this to me just at least starts discussions also between those of you listening to Make Me Pretty podcast today, and you know, if anything, start those discussions with your provider and really kind of think about some things. It's important that you take care of the health of your entire body, but you know, your vaginal health is important, whether we're talking about using that for babies, for sex, for just comfort, for your daily health. And there's a lot of subjects that surround the things that we spoke about, but these are at least some of the things that you can start addressing or at least think about on your own. And Rhonda Massey, thank you again.
You're welcome.
For coming. Your expertise, again, I always say folks are not a professional until 10 years. So you're over that. And that's not really true. Those of you who are only in practice for 3 years and stuff, okay, that's fine. But I feel like there's a lot that we all start to see so much. And so again, for you to come here and discuss your expertise on something that a lot of us really do like to discuss, but you know, it's your private part. So it's a private area and it's good to talk about. I think she and I are going to meet again soon to talk about some even more private, fun stuff. Well, I always want to break into song with "Let's talk about sex, babe." So anyway, it is coming up. So look forward to speaking with her again, and you guys look out for that. Please take the time to like, to share, to comment, to download the episode. Anytime you do share this, especially via social media, please do let me know, and I will translate some of that information to Rhonda Massey. And I will also have her contact information will be listed in the discussion points and paragraph that's listed with the episode. And again, thank you so much, Rhonda, for coming to Make Me Pretty podcast and doing this interview with us.
Yeah, thank you.
Thank you. Until next time.